Hi everyone, my name is Willie and you are listening to Humans of Authenticity, the CEO Special Editions. Our guest today is Joe Lindahl, Chief Executive Officer at Mission NSA, and I'm so excited to introduce him to you in this episode. Welcome to Humans of Authenticity, Joe.
Thanks, V. Thanks for having me.
Would you like to introduce yourself to our listeners first?
Sure. Yeah. So I'm Joe. I am the CEO for Mission MSA. And Mission MSA is the patient advocacy organization for those who are affected by a disease called multiple system atrophy. We are a rare disease. We estimate between 15 to 50,000 individuals in the United States have multiple system atrophy. Multiple system atrophy, the best way to describe it is a mixture between Parkinson's and ALS. The symptoms look very similar to Parkinson's disease, but the disease progression is much quicker, similar to ALS. The diagnosis generally ranges between the ages of as young as 40 up to 70. And from diagnosis, individuals generally have a life expectancy between 6 to 10 years. So it's a very rapid disease. What we do is we advocate, we raise awareness about the disease because I'm sure most people have never heard of it. We also support research directly to explore how we might actually slow this thing down or hopefully find a cure. And it's a really exciting time actually in our area for disease research. There's a lot of promising things coming out. So we're really excited to be a part of that and make sure that the patient voice is heard throughout the process. I've been at Mission MSA for a little over 3 years. Before that, I was a true association person. I've worked in AMC environments, I've worked in standalones, professional societies, I've done specialty nursing, I've done staffing, I've done a lot of different things. I started my career really in marketing and kind of stumbled into operations, board governance, components, and it moved my way this way. So it's been a very interesting journey, as most association execs, I think, would agree. No day is exactly the same, and no position is exactly ever the same. It's a really interesting industry that we live in. So that's who I am. I've been pretty active in ASAE. I am a DELP scholar, as I know you are as well, V. I've been a part of the Component Relations Council, Small Staff Advisory Council. I'm now a member of the Conscious Inclusion Committee, and I'm also a volunteer on the AA-NHPI Steering Council as well. It's been a great organization to be a part of. So I think that's me in a nutshell. I'm out of Chicago, and I have a 2 and a 5-year-old at home, so I'm always working and never bored. So yeah, that's me.
Let's talk about Mission MSA for a second. As I've
Mhm.
heard you describe the organizations and the work that you've done in raising the awareness of this rare disease,
Mhm.
who are the audiences that you guys are speaking with to achieve the awareness raising mission?
Yeah, it's a really interesting topic because it's a lot of segments that we're trying to raise awareness on. We can start with the big one, the general public that have never heard of the disease. So often we look at ALS. Everyone knows ALS because one, it's also known as Lou Gehrig's disease, and two, the Ice Bucket Challenge. What was that, 10 years ago or more? We all did it. It was the first viral thing that we all did. We kind of knew what it was, and that really, really did make a significant difference, both financially as well as just what is ALS? And so we're a very similar disease, but no one knows who we are because we haven't had that viral moment. So for us, we're always figuring out how do we at least bring ourselves into the public consciousness. And we feel like the benefit will be the more that the public knows, the easier it is to pass that along to their providers, to their elected officials, to just raise it. This is an important thing to explore. We also talk about how do you raise awareness with general neurologists or your primary care provider. In a disease like ours that no one really knows about, it's really hard to get an accurate diagnosis. It's difficult, even for an experienced movement disorder specialist who are our primary physicians that actually provide diagnosis. But if you go to a primary care physician, they're not going to even know what to look for. Even a general neurologist they will be able to generally support a Parkinson's diagnosis, but anything else is difficult for them to even know that this is an option. So we think of it both from an awareness perspective as well as a little bit of education of this is what this disease is, and here's some things to be aware of. We don't necessarily need them to be experts, but we do need them to know that this is an option and then provide the right referral. And this year, I would say we're putting a lot more resources into bringing more awareness to elected officials and their staff. So we are going to have a Hill Day this year. I did my first Hill visit a few weeks ago. We're trying to get more exposure to the National Institutes of Health. Just to, again, this is a disease that really does matter. And it's important they understand the impact of it on their community, on their constituents, and also that they understand the severity of the disease and the sense of loneliness and why this all matters in the health context. Multiple system atrophy is an incredibly lonely disease. That's what I would call it because most people have never heard of it. You are fighting actively to get to the right diagnosis, which is a really difficult thing for a person to self-advocate to multiple doctors saying, I don't think this is right. That's not built into our DNA to say, I don't think you're right. And through that is where a person will get the right diagnosis because they're willing to fight to get to the right thing and to get a sense of validation that what they're feeling is right. So when they get the diagnosis, they are generally never heard of it. They don't even know what to do. They've been given this diagnosis that is much more rapid than they probably thought it was going to be. So now they're trying to figure out, how do I take this thing on? How do I adjust my life? I have to have a will now. Who's going to be my primary care partner? All these things are very rapid and it's very isolating. And so as the organization, from an awareness perspective, it's important they even know that we're here. As the organization for them, we are the community that can provide a lot of answers, a lot of connections, a lot of education to make sure that they feel comforted and connected and a little bit empowered as they go through this journey. That's a very difficult one.
Thank you for breaking down the level of complexity in this message. It's interesting that you mentioned the bucket challenge. And I think in terms of marketing and public relations, that was one of the first viral case studies for us in getting a message across to the general public. I found that when we talk about raising awareness with any sort of campaign, it's very hard to measure the impact of the work that we've done unless we give it a couple of years. How do you plan for your awareness raising campaign? What measure do you put in place to make sure that your activities is effective? And do you have a short-term versus long-term measurement? Can you talk to us a little bit about that?
Yeah, it's a really interesting question. And awareness and advocacy, I think, are long-term investments. I think they are not sprints, and sometimes you will not see the fruits of that labor for years, if not decades. I think if we throw it into the advocacy, government relations, awareness aspect of it, we know, because we can look at other similar diseases, of how long it took for them to make meaningful change at a policy or legislative level. We're talking years, if not decades, but just the momentum of showing up, knowing faces, building relationships, and having the right people in the position to create influence. ALS is a great example. I do point to them quite a bit because, again, similar patients population size, similar disease progression. And so they have definitely done a fantastic job of creating policies that specifically benefit their disease state. One is the Medicaid waiting period. There isn't one. They actually have an exemption because they have it built in. They advocated for it. And that's a meaningful, tangible thing that made a significant difference. When we think more about awareness for the general public, that's the more difficult one to measure, right? We're measuring our donations, for example. We are very much a small gift supported organization. We don't have lots of big gifts coming in. We don't have any grants from the federal government supporting us. It's really from patients and their care partners that are providing a lot of the support. What we would start to measure, though, is how much new traffic is coming through, how many small gift donations are coming from people we don't really know, how many new donations. We can take different measurements and say this is starting to make a difference. We're doing something kind of new because March is MSA Awareness Month. We're actually going to put a billboard up. And what we're going to do is track what is the reception to our website from these specific areas where these billboards are. It's just a way for us to try and understand how many eyeballs are coming in. We've also shot a documentary, which is going to be released in a couple weeks. It is a short documentary. It's called Viewpoint with Dennis Quaid, and that will be in over 160 million households throughout the year. So we can measure that, right? And at least know that the words multiple system atrophy, what that means, it's all we need them to know. I mean, we are constantly competing for attention for literally everything. So it's an unrealistic ask for them to be experts on what MSA is, but we just want them to be in the consciousness. So often we've been called, if a patient said, I have MSA, a person might say, oh, do you mean MS? No, we mean it's a completely different disease. It's getting to that level. And I think it will be difficult to measure in some instances, but we'll also know because when we talk to people, when we send out surveys, the less we're having to explain what it is, that's the win, right?
Thank you for that.
Mm-hmm.
When you have the list of audiences that you want to communicate with, how do you make sure that your message is relevant to each of these audiences?
Mm-hmm. Mm-hmm. Right. We definitely try and tailor it. So for the general public, it's attention grabbing. Like the billboard will be eye catching. We want it to draw them in just to learn a little bit more. When we're talking to general neurologists or PCPs, we're trying to tell them what to look for. Why does it matter? If they just accelerate this a little bit, how do they support a shorter time to diagnosis? That really matters. So we do provide tailored messaging, especially with the healthcare community. We want to bring in more than just physicians. We want to bring in nursing. We want to bring in speech pathologists, dietitians, occupational therapists, because they all touch and probably have seen an MSA patient. The more people we think are just know about the disease, the better the chances are for the patient to be diagnosed correctly earlier and receive the adequate care. So the awareness for us in that hemisphere is really those two core objectives and then giving them tools to be the best practitioner they can be. I mean, that's the carrot in some of this awareness piece. From the elected officials, we single out core stories so they understand the real human impact, but there's also a lot of different variables we bring that are important. What's the economic impact of a disease like ours? Do you understand the economic burden up to the individual and the family? There are some things that we can bring to the table when we talk about MSA that aren't just about the disease itself, but it is about the impact to the person, their family, their friends, and ultimately the larger community that they represent that is very impactful. So there's a lot of things that we do, to your point, try and tailor the messaging so that they're receptive, they have an open ear, and can really understand how MSA touches something that's near and dear to their hearts.
This is really cool. I feel like this is a masterclass of tailoring message.
Mm-hmm.
You've been with Mission MSA for 3 years now. What would you say is your proudest achievement in the last 3 years?
Proudest achievement is a great question. It's a hard one to answer because I don't think anything is done because of a person, right? Like my proudest achievement is obviously a team and organization shared achievement. So it's hard for me to say my proudest achievement. Gosh, there's a bunch of things we've done in my 3 years. We created a new brand. We used to be known as the MSA Coalition. We're now known as Mission MSA. We redid our website as well to be much more user-friendly and intuitive. The rebrand was purposeful because we really sat back and assessed from an awareness perspective of people outside the MSA community right now, when they read this logo or see this logo and go to our website, what's their reaction? And so we made adjustments to be more inclusive, more accessible, and more straightforward about who we are. We have our tagline, leading the charge to cure multiple system atrophy, because that's who we are. We do a lot of different things. We do education, we do support, we support research. At the end of the day, we want to find a cure for this thing. And we are going to lead or facilitate however we can to get there as quick as possible. I'm also really proud we propped up a Centers of Excellence program, which I know a lot of organizations have done. We are now up to 31 Centers of Excellence around the globe that can provide amazing interprofessional, interdisciplinary care for the multiple system atrophy community, which is really important for a patient to know where to go and feel like they're being heard, fully understood by professionals that can really help them through this really difficult journey, navigate them to pertinent clinical trials, and answer questions they might have. That's so important. And now the next iteration of our centers is really to facilitate more research from a global standpoint. It's a rare disease. So there's challenges of getting to right numbers and participate levels. But if we can successfully match these institutions with one another, we think that there's an opportunity for them to create really amazing outputs that will help us better understand the disease, find a biomarker, slow disease progression, all of that's the end goal. And we think we have the institutions and the experts in our community to support them through some monetary support, but as well as just facilitate natural collaboration. So I think those are the things that I'm most proud of. And I think this organization has just grown. Our staff size has gone from 2.5 to 8, which isn't a huge number, but it is growing because we're putting more resources. We're trying to meet our mission and trying to really be there for our community. My keyword is meaningfulness. People sometimes will ask, why did you go from a pure membership-based association to more of a cause-based nonprofit? And I said, it's because I wanted to take the chance and feel the work a little bit more intimately. I have patients on my board, I have care partners, I have researchers. We have the full community that's affected by this disease on the board, which is amazing. And then also just going out into the community, talking with researchers, getting to know other patients. You really do feel the work that you're doing making a difference. We want to cure this thing. We do. We want to make it easy to diagnose this. We want to do all these things, but it is incredible to, one, get to know a community that is, I think, one of a kind, and I'm absolutely biased. But the amount of resilience in wanting to give back is unmatched. And it really does restore your faith sometimes in humanity, because a patient diagnosed with MSA knows realistically they will pass away without any real opportunity of a disease modifying therapy or anything really to save their lives. But what they are willing to do is go through clinical trials and go through different testing to support work that is going to hopefully make a significant difference in MSA patients in the next 10 to 15, 20 years. That's amazing to me. And this is why I want to do the work that I do. I want to hopefully make a small indent of positivity in some slice of humanity before I'm gone. I mean, that's why I think if I can do it, if I have some skills, if I have some passion around this, and I'm decently good at this, I want to do it. Like, it's the juice that gets you up in the morning, right? I can't really think of another role right now or opportunity where I can make the difference that I feel like I'm making with the amount of information and knowledge I've gained to really help advance this work. So I think that's why we do it at associations also as well. It's just been an amazing opportunity just to feel like the things that we do, the resources that I hear almost firsthand. Wow, thank you so much. That really saved us. Or someone comes along and says, I didn't know what the heck to do. How do I find a connection? And so thank you to whoever, whether it's a staff person or a volunteer. This might sound over the top, but you really saved my life. I didn't think I could go on. But this connection, this conversation, this resource, this knowing that I'm not alone, I'm willing to keep going. That's an amazing conversation to be a part of.
I'm seeing a lot of passions coming out from the story you just shared now. Thank you for sharing that passion. When you talk about your keyword meaningfulness, you say something about take the chance, as in moving from a membership-based to a cause-based organization. And you also say you want to feel the work more. Can you elaborate what exactly that means for you?
Yeah, I worked for specialty nursing groups, a specialty physician group, and it's amazing to be a part of that board and listen to the conversations and how they're treating their patients and things they think that how care can be improved or accessibility for patients can be improved, which, are often conversations we're having as well. Or if I'm working on a protocol or a white paper or a position statement or publications, like all those things are very useful for the practitioner. But I never felt what that meant for the actual outcome. providers and professionals want to be better providers and professionals so they can provide better patient care. At the end of the day, that's what they're there for. I rarely heard from a patient. I don't think I ever heard from a patient in my 12 years prior to joining Mission MSA. And I think maybe that's something to think about. So when I worked for the Neonatal Nursing Association, I never heard from a neonate parent of how, these resources help them navigate taking a neonate home. That's a scary thing. It's a big deal of how do you take your baby home for the first time? That's a small baby. They have very unique needs. It's a very scary thing. I remember being a first time dad and putting him in the car seat for the first time. You're like, it's like buckling a little piece of china. And there's no right or wrong. I just wanted to feel it more at the end of the day and say, wow, okay, that's really great. I just needed a little bit more of a boost where I was 3 years ago. Doesn't mean I'll never go back to associations, or that, this is just what I needed at the time. And so that's kind of what I meant by the meaningfulness aspect of it.
If I might share what I've just heard in terms of reflections, what I'm hearing is as you work with membership-based organizations, know how the outputs of the association is being used by the members. But our members doing their work to support their clients. So they have another end users out there, and you feel that you were a bit distant from the end users of your product. Say you were able to not only work with your clinicians, but also the patients and the end users of all of your outputs. And that connections give you the sense of meaningfulness in the work that you are doing. Is that the right descriptions?
Yeah, what I have enjoyed about this is seeing the work that we do tangibly affect an individual or community. But I've also really enjoyed having those 360 conversations, because if we're centered around a disease, we have to bring everyone that is affected by it, pursuing research, trying to find a cure for it, all in a room. There's power in that because you have the full enchilada, as it were, in front of you, so you can really know how to cook it. What I'm semi-curious, passionate about is talking to other healthcare organizations and saying, where are your patients? Because you are designing something that's going to touch the patient population, the care partner population. Why aren't they at the table as you're designing a resource or designing an intervention? They should be. It's important for them. It's like any other product development piece. You don't just go have a bunch of engineers and then just kick the product out. I mean, that would be riddled with confusion, most likely. You need to bring the end user in early in the process. And I think what we've seen, at least from industry and pharma on our side, is more willingness to do that. We are seeing more patients being introduced, being brought in as advisors earlier in clinical trials, which is immensely important for a disease like ours. So when I say meaningfulness and the 360 and all that, I've loved it. And I hope other healthcare professionals have thought about more about this. Patient centricity has certainly become more of a topic of interest. And I hope that, we continue to see more patient advocacy and professional society interactions long term, not even just on single projects, but also just top of mind. From a strategic lens, the things that professional societies do and cause-based or disease-specific organizations do often overlap. How do we make sure we're not being duplicative? How do we make sure that we're not unintentionally going opposite directions? And I think it's having those purposeful, open discussions. Something may or may not come of it, but just having check-ins, I think, ensures a little bit more alignment and that we have the right voices in the room when we are ready to implement a strategy or a big project. I got to have the patience in the room.
Yeah. This is true. And you remind me of the patient-centered care concept within the medical associations. There need to be a path for co-design so that we can involve the patients and the end user of the solutions. And you also remind me that as we involve the patient in the conversations, that's how organization can stay relevant in the work that we do. And I think that helps you to tell your story better.
Exactly right. Exactly right.
Thank you for sharing that. Mission MSA is about 30 years old. And I'm very impressed of how fearless you already expand to the global stage. what infrastructure do you put in place to be able to move that quickly?
Yeah. I will say it's kind of started from we're here for anyone. Like, we don't care where you are in the globe. MSA is such an unknown disease. Come to us, we will do the best we can to support you. Like, we are a US centered organization, so there will be things we can't maybe help you out with because you're not in our healthcare system, for example. But we're here for resources. We can make sure you're in our community from our online community, such as MSA Connect, peer support. We'll connect you with the people we know. And it's a welcoming principle. What we've also done is we've tried to establish stronger connections and relationships with other MSA groups, which there aren't many. There is actually one in Australia. There is one in England, the MSA Trust. When we have increased our Centers of Excellence program, we started with 19 in the United States because we wanted to first pilot out the program and see how it went, who could meet our criteria. And then we opened it up this year, and now I believe have 5 or 6 around the world, a couple in Europe, a couple in Asia. And so our intention here is to support the Centers of Excellence with education, with a peer support group, start at the grassroots level, leveraging the networks that these institutions already have, providing them a little bit more of infrastructure and support, and then kind of seeing how we can continue to grow. We're not a large organization, like I've already said, but we are probably the biggest. And so, how can we support the growth? How can we help support seeds that want to grow in other parts of the world? And often it could be they can learn lessons from us of how we started. What were our growing pains? What do our patients like? What do they not like? What kind of education have we provided? How have we interacted with our medical community? How we interface with industry? Just to give them a sense of opportunity of how they can do the lift. Because as I'm sure you know, and most of our listeners will know, sometimes chapters and components or small organizations, when they're starting, it's a person. And it takes a special type of person to go through a full nonprofit incorporation status and do all the things until they get to a place where they can hire staff, which is how we did it. It just took 25 years. And so you have to be ready, but we don't want it to take 25 years for everyone else. We wanted them to be quicker. So however we can support them, we want to do. Now, as we go through the centers more, if we see larger pockets of, say, more in Germany, for example, we will examine the best methodology for us. We could continue to do more the hands-off-ish, but supporting mechanism, or we might look at a different way to make sure that these patients are getting the support they need. And we want to be accessible. I mean, one of the significant advantages for a local person doing the local organization, they know the culture, they know the language, and they know all the in-betweens that we would never know. But from an accessibility perspective, a lot of our things are based online. We have virtual support groups, and we're looking at translations. Those are the things that we think we can easily do, but we'll continue to examine because this is an underrepresented disease. The number I gave, 15 to 50,000, that was in the United States. So it's about 2.5 to 3 every 100,000 people.
Wow.
So we think it's underrepresented, and the reason is because it's first misdiagnosed with Parkinson's.
Mm.
So we feel fairly confident that it's more than that. And so the way that we can support them is getting a better handle on the diagnostic journey, getting an earlier diagnosis. And I think if we do that, more people will be interested in an MSA specific organization. We're in the very early stages, but certainly from a global standpoint, we want to be involved.
Talking about from the branding standpoint, it sounds like you are building Mission MSA as a leading organization in this space globally.
Yeah, I think we are already recognized as the leading organization. We have certainly been established the longest, and we are very globally partnered minded, right? We've also been working as an organization more with the Michael J. Fox Foundation, the Parkinson's Foundation, Cure PSP, which is another atypical Parkinsonism. We're trying to find partnerships and alignment. The underlying pathology and biology is similar in those diseases in many ways. So we're trying to find partnerships as well that can really help us get the awareness out. So for Parkinson's, we go to these events that are mostly in North America right now, geared towards newly diagnosed Parkinson's. We have a little table and just say, hey, this is another disease like Parkinson's. Just be aware of it. Because if it doesn't progress the way normal Parkinson's does, explore these other options. Have a conversation with your neurologist and see if you can get a referral to a movement disorder specialist to make sure that this is the right diagnosis. Because it is a clinical diagnosis. There's no test anyone can take right now and say, you definitely have multiple system atrophy. It doesn't really exist per se. It is a clinical diagnosis. There are tests now that can confirm you have one of the four diseases. And then you'll have to go through a scan, and then you can get a probable diagnosis of MSA. But you have to see a specialist to do that. It takes forever to get there. So it's why it's so important that we raise awareness also with the Parkinson's organizations. And they've been great partners as well. At the end of the day, we all just want the patients to get the right diagnosis and the right care for the disease they have. So
Patient's perspective, how do they navigate all of these situations when they get a piece of paper in front of them?
it's incredibly difficult. I mean, there was a study done by the Parkinson's Foundation a couple of years ago, and I think they came out with the number around 700 movement disorder specialists exist in the
Wow.
United States. That's it.
Gee.
700 for 350 million of us. So just the lack of resources. And
Okay.
then if you're in a rural area, there isn't a movement disorder specialist, for example, in the state of Wyoming. It doesn't exist. You have to go to Mayo Clinic. That's where one of our patients has gone because that's the only place you can get the right kind of care and the accurate diagnosis. Accessibility for us is a significant issue, not only for the diagnosis, but also when you have the disease, getting around becomes much more difficult very rapidly. So going and being able to get the right occupational therapists, speech therapists, it's very, very difficult. And then from a monetary standpoint, it is very expensive to deal with this disease. You have to stop working. Most likely your partner has to stop working or go down to part-time. And oftentimes our patients are around 60. So they're not ready really to retire. And all of this kind of just creates a really significant weight on their shoulders as they're going through this disease.
As the leader of Mission MSA, understanding the stories of the patients while going through the experience, does that add more pressure, more weight on your shoulders?
It's a question I get fairly often. A little bit. I mean, I'm a human, and I think compassion and empathy has to be built into your DNA a little bit to do this work and want to do this work. Yeah, is it hard sometimes? Sure, it is. But I lean on the strength of the folks that are my volunteers, my board, have the disease, lost a loved one to the disease, and they're still here. They don't have to be. You could say, I never want to hear the phrase MSA, multiple system atrophy, ever again. They took my mom, they took my brother, they took my sister, they took my granddaughter. All that, I think, helps you look outside yourself a little bit and to actually look at it. If I can make anyone's lives better, that's why I'm here. I do feel, yeah, pressure, yeah, a little bit. You got to show up. This is incredibly important work, and I'm going to do my best every day to try and make that happen. And I think my staff feel the same way, and our volunteers feel the same way. So it certainly is a different level of pressure, but pressure can be a privilege.
I hear that. How do you look after yourself to make sure that those pressure doesn't get into you?
Yeah, I think it is certainly finding the joy in the little things, right? Like when we do things and we make a contribution, we launch a website, we launch a new program, we get a really good number of registrants, we see a clinical trial go to phase 2, phase 3. I think those little wins really matter because you feel like you're taking a step forward. The step might feel like you're kind of in mud or in concrete a little bit, but you're taking a step up a mountain, and we certainly are. And I think of it from a perspective of like, I want to make sure that my kids don't have to deal with this disease. And so that adds a little bit of personalization to it, but certainly keeps the goal in mind. And for me, that makes it easier sometimes. I mean, we stay focused on the work we're doing and why we're doing it. And, just being around family. Naturally, I don't think I'm a very stressful guy. Normally, I'm fairly calm. I think it takes a decent amount to get me frazzled. My wife would say I'm not the greatest at self-care, but I also am like, okay. I can spend time with my family, and when I'm done for the day, I'm done for the day. I spend time with my kids, focus on family, try and get out in the great city of Chicago when it's warmer. So I try and not let it bleed over the work.
Thank you for sharing that. Last questions before we close for today. If you think about your entire career and your journey so far, what is the one thing that you love the most about yourself in that journey?
I think willing to just take a little bit of risk. I came into associations, it was 2008, which for those listeners that are of a certain age, that was a huge recession. And I had a degree in journalism. And that was also the time like no one was reading newspapers anymore. They hadn't figured out monetization really on the internet. And so no one was hiring writers anymore. And so I stumbled into associations and just kind of just kept saying yes. And once I knew I liked the work, I liked this kind of environment, I like mission centeredness of it all, I tried it like mission marketing. I started in marketing, then I went to operations. Sure, why not? That's kind of cool. Then I moved to DC just because I wanted to try something. And I started a job doing strategic programs. And then I went over to a trade association and just did chapters. And then I came back to Chicago and I'm a senior operations person. And then I took my first ED job and then my second in kind of different arenas and was just like, let's try it. Now I'm here, right? What I love is I was willing to take risks and it got more strategic as it went. At first, it was like whatever comes along. And then it became like, okay, I need to pick up these tools, put them in my tool belt for the mountain I want to go up. And that's what I'm pretty proud of myself for doing that because I have a lot of different varied experiences that I think have been really helpful for me. So that's what I'm pretty proud of myself for doing. Yeah.
Congratulations. If you're looking at your toolbox at the moment, what is the most important tools in that box that you suggest whoever wants to explore the CEO ED path definitely have to pick up?
That's a very, very good question. Because I'm sure it's going to be a little different from everybody, right? I'm a big believer in leaning into the things you're already good at. And if you're a really good people person, or we just did Strength Finder, so this is top of mind for me. I'm a really good relator, but I'm not like in the room, aggregate everyone, pull them in, and stand on a box and wax poetic. That's not my strength. I'm very good at one-on-one relationship building. And so I've leveraged that really well in my board relationships because I feel like building that kind of intimacy is incredibly important so that there's trust. I can plan, no surprises. That's really important. And so that we're kind of going through this funnel together. I think the other thing is that I've really picked up on the last 3 or 4 years is I have a lot of experiences that I bring up for discussion, but I also have been very cognizant of how fast things have changed in our world. So what may have been relevant 7 or 8 years ago isn't really relevant anymore. And I have to be willing to adapt and relearn and accept things not being the way I used to do them, but really be open to the idea of doing things completely differently, which from my perspective in my toolbox, I love change. I actually do love change. And I know not everyone does, but I'm totally okay with fail fast. It seems like a good idea. Didn't work for X, Y, or Z. We learn from it. We move on. And so I think that's been something that I've really come to appreciate with that is quote unquote in my toolbox and just, asking for forgiveness sometimes. And the intentions are pure. Here's how I did, why we thought this, and it didn't work. And I think that's something that my staff should do too. It's okay. Tell me why. Now, don't just go drive the truck off the bridge because you can. But first, tell me why you want to get rid of the truck, right? That's totally fine. There's not one way to do one thing anymore. And I think that's good.
I love the openness attitude that you just shared. So open to new things, open to change, which I often brand it as opportunity for improvement.
Hmm.
Want to introduce something new to the team. And I love that willingness to take risks. What I'm also hearing is as you give yourself an opportunity to try different things, that's where you can find the meaning in the things that you have done and strengthen yourself and your capability.
Exactly. Exactly. Keep why you're doing it in the front and then the rest will figure it out. I think that's a Brene Brown thing.
Yeah.
It's so true.
That's great. Thank you so much for spending the last hours with me. I've learned a lot from this, and I hope you have a great experience during the conversations.
My name is Joe Lindahl, and you are listening to Humans of Authenticity, the CEO Special Edition.